Hello, Clinic Review family. It's Dr. Sharon from Clinic Reviews, the very best NCLEX review in the world, in my opinion. Go to clinicreviews.com, the website, not the YouTube channel, to get our online on-demand review. And also, there are sometimes in-person reviews with Mark Klimek himself, so you can sign up there. Thank you for supporting our channel. To all of our channel members. And let's see which side. Oh, this side. Okay, they're going to be coming up this side. Thank you to all our channel members. And if you're interested in paying me for something, you can go to clinicreviews.com. Again, the website, not the YouTube channel, and sign up for my small group Next Gen online tutoring with me personally. And you can talk to me. I'll even unmute you at the end, and you can ask me not personal questions. You can ask me questions personally. All right. So let's not bury the lead. We're going to be talking about assessment today, fundamentals, assessment fundamentals. And this is actually, you might be surprised what you find in here. This is actually a very good series of questions. So I hope you will watch it. So let's go ahead and get started. There are actually 10 questions today, so maybe a little bit longer than some of the other ones have been. Which action by a patient marks the beginning of the physical assessment process? Again, notice it's a vague question, so we don't want to be too narrow in our thinking. Which action by a patient marks the beginning of the physical assessment process? Redressing after a physical exam, breathing normally during auscultation, greeting the nurse in the examination room, sharing work environment information. All right, so I always read the question, read the answers, read the question again. Which action by a patient marks the beginning of the physical assessment process? Well, that helps a little bit because it's the action by the patient. So redressing after physical exam, that is being done by the patient. But that's not the beginning of the physical assessment process. I'm crossing off A. Breathing normally during auscultation, that is done by the patient, but that is during the physical exam. It's not marks the beginning of the physical exam. Greeting the nurse in the examination room. So that is the very first interaction with the patient. So that nurses are really assessing from the moment they see the patient, right? They're looking at them, looking to see how groomed they are, how clear is their speech, right? You're constantly assessing them. I don't always ask my patients all the orientation questions all at once. A lot of times I ask them those orientation questions throughout the exam as we're going. It seems more natural. It's not as like, do you know who the president is, right? It's like I try to gather some of that data, especially if they're really quite oriented. I try to gather that data as we go through. Nevertheless, the greeting is the very beginning of that assessment. Remember, assessment is gathering data. That's all assessment is. Assessment is not just listening to lungs or checking cranial nerves, right? Assessment is gathering data. And a history is part of the assessment. Assessment is history and physical exam. So both of those things are assessment. Sharing work environment information. So if the patient shares work environment information, is that the beginning of the physical assessment? No, because I don't know when they're going to share that. They could share that at the end. So greeting the nurse is the beginning of the physical assessment. I guess I'd rather just say assessment, but that's fine. Okay, 2, which action by the nurse is most appropriate during the orientation phase of the patient interview? So the key word here is orientation phase, orientation phase. So orientation phase, you should know the different phases of the working relationship. And during the orientation phase, we're getting to know the patient. We want to establish trust. A lot of times people skip the orientation phase. I don't know if you've ever been in the doctor's office and the doctor walks in and immediately starts talking business, right? You're kind of like, okay, I don't even know who you are. I've never seen you before. You're just talking business, right? It's nice if there's at least a little bit of an orientation phase. It doesn't have to be very long. It can be maybe just a few sentences, but you would like to have some kind of orientation. Always position patients in a comfortable reclined position to ensure their comfort during questioning. Ask which name a patient prefers to be called during care to show respect and build trust. Quickly conduct a review of systems to determine the need for a complete or focused assessment, and begin with questions about intimacy and sexuality to address sensitive issues first. Well, I sort of answered the question just by explaining to you what the orientation phase is. I told you the orientation phase is to establish trust. And the only one that establishes trust, in fact, it even says it establishes trust, is B. We certainly don't want to put them in a reclined position during orientation. We may need to do that at some point during the physical exam, but not during orientation. Review of systems is part of the physical assessment. It's part of the working phase. It's not part of the orientation phase. And intimacy and sexuality questions probably want to wait till a little later, not right off the bat. So the purpose of the orientation phase is to establish trust. So make sure that that you remember that. That's actually a key word that will help you get some of these questions right. Not these questions, NCLEX questions. Which activity by the nurse best demonstrates part of the working phase of a patient interview? Summarizing, select all that apply. Summarizing previously discussed key topics, including selected family members and care planning, transferring care responsibilities to the home health nurse, and discussing health promotion activities that could be beneficial. Which activity by the nurse best demonstrates part of the working phase of a patient interview? All right. So there's orientation phase, and then the working phase, and then the termination phase. And while there's the pre-orientation phase, the pre-orientation phase is when the nurse examines their own feelings about things. Then there's the orientation phase where you establish trust, and then there's the working phase. Now, if it helps you, and this helps me, so that's why I'm sharing it with you, I think of the working phase as the care planning phase. Now, that doesn't mean that we're just assessing it. Care planning is assessing, diagnosing, and intervening, and then evaluating whether your interventions work. So any of those things can be done during the working phase. And so I say, is this a part of care planning? So which of the following demonstrates the working phase? So I'm going to say, I'm going to actually say which is appropriate to do during care planning. Summarizing previously discussed key topics is appropriate during the care planning phase. No, we don't summarize previously discussed. That's not part of the care planning. You might say, well, that's part of the evaluation. No, it's not actually. It's done. That's done at the end. Like, okay, we're all done. Let's just summarize and I'll see you later, right? So no, that's not part of the care planning phase. Including selected family members in care planning is important during care planning or during the working phase. Yes, we do want to include selected family members in care planning. Working phase is care planning, and we do want to include family members. That's good to do. Transferring care responsibilities to the home care healthcare nurse is important to do during care planning. No, that's done after you're done care planning. Then you transfer responsibility to somebody else. So no. Discussing health promotion activities that could be beneficial is something you do during care planning. Well, yeah, that is part of what you do during care planning. That's part of the intervention phase or the intervention step where you're discussing health promotion activities, teaching. So yeah, so B and D are things we do during care planning. Which entry in a patient's EHR best indicates the need for a nurse to gather secondary rather than primary subjective data? Complaining of chest pain, apical pulse 110, comatose, or difficulty swallowing. Now, I put this one in here not because it's so hard, but because you have to know the difference between primary and secondary subjective data. Subjective data is what I tell you. Okay. Objective data is things I assess independent of what you tell me. So like the apical pulse of 110 is objective data. Complaining of chest pain is subjective data. Okay. So that's subjective and objective. That's not secondary and primary. Primary subjective data is something you tell me about yourself. If you're telling me about yourself, that's primary subjective data. If I say, I'm having chest pain, you're the nurse, I'm the patient, I'm having chest pain, you say that's primary subjective data. But if I'm comatose and somebody else has to say they've been really restless lately, they've been moaning and groaning a lot lately, you go, okay, that's secondary data because I can't tell it to you because I'm comatose. Okay, so secondary data is data other people tell you about the client. And secondary data is not wrong, y'all. Don't say, well, you should never get secondary data. False. That's not a rule. You can absolutely get secondary data, especially if the patient is not a reliable, if they're not a reliable witness, so to speak, right? They're confused, they're disoriented, they're comatose, they can't tell you, or if they're underage and they can't really talk very well, they're 2-year-old, right? Secondary data is absolutely appropriate to get. All right, next question. Which line of questioning by the nurse best represents an appropriate approach to the review of systems aspect of the assessment process? Now, I included this in here because I don't think many of you know what review of systems is. Now, I could be wrong. If you know what review of systems is and you get this answer right, you're the goat. You're the goat, y'all. All right. What do you do for a living? Can you describe your work environment? Is there a family history of heart disease, cancer, high blood pressure, or stroke? When was your last annual physical? What immunizations did you receive at the time? Do you have any chest tightness, shortness of breath, or difficulty breathing while exercising? All right, let's reread the question again. Which line of questioning by the nurse best represents an appropriate approach to the review of systems? Review of systems. The review of systems is heart, brain, lungs, gut, legs, feet, right? The systems. I'm reviewing the systems. Okay. Aspect of the assessment process. So, what do you do for a living? I'm going to cross that out. That's social. Those are social type questions, not review of systems. So I'm crossing that out. Is there a family history of heart disease, cancer, high blood pressure, stroke? So that sounds like review of systems, but it's not. That's history, and it's family history, not them. Review of systems is review of their systems, not a family history. So I'm crossing off B. When was your last annual physical? What immunizations did you receive at the time? That's an immunization health history, but it's not a review of systems. That's a history, not review of systems. You want to find out about their systems. Do you have any chest tightness, shortness of breath, or difficulty breathing while exercising? So that is only reviewing one body system. But it says which line of questioning by the nurse best represents an appropriate approach to the review of systems. D is the only one that is an appropriate approach to review a system. So you ask them specific questions about body systems. This is asking specific questions about a body system. You have any chest pain, shortness of breath, constipation, diarrhea, difficulty urinating, difficulty getting your stream started? Do you see how I'm asking specific questions related to their body systems? So the correct answer is D. So make sure you know what a review of systems is. Which cue by a patient can be validated by laboratory and diagnostic test results? So I'm teaching you what a cue is, y'all. Do you know where you learn this stuff in your fundamentals class? Do you know when you forgot this stuff after you finished your fundamentals class? As soon as you took your last exam in your fundamentals class, you forgot all this stuff. And you got to know it for the NCLEX. It can be on the NCLEX. Okay, which cue can be validated? Deeply sighing with fatigue, bilateral crackles in the lungs, oxygen saturation of 98% or more, 2+ pitting edema of the ankles and feet. Which cue by a patient can be validated? A cue is not a physical assessment finding. A cue is something you notice about them. That's what it is. A cue is something you notice about them. It may be a comment that they make, but it's not a specific physical assessment finding. It's either like an offhand comment or just something you notice about them. So B is an assessment finding. C is an assessment finding. D is an assessment finding. A is the only thing that is a cue, that represents a cue. Now, you might say, well, this is a bad question. How do you validate it by laboratory and diagnostic test results? So, you might say, well, what laboratory and diagnostic test results can I follow up with? Well, first of all, that's not the question you should be asking. You just say A is the only cue there. I got to pick it because it's the only cue there. Whether I can think of a laboratory or diagnostic test result is not the question. However, you could do a hemoglobin and hematocrit. Are they anemic? If they're fatigued or whatever. So A is the only cue. So you need to know what a cue is. It's not the same as an assessment finding. 7, when initiating a physical exam, which action should the nurse take first? Now, the key word here is the word first. So you might say, well, I would do all these things. Good, but which one would you do first? Review of the patient's prior medical records, gather admission health history forms, assess the patient's vital signs, or perform light and deep palpation for fluid. When initiating a physical exam, which action should the nurse take first? Now, I put this one here to teach you something because I struggled with this one a little bit. I'm like, am I supposed to review the patient's prior medical records before I do a physical exam or gather admission health history forms? So here's the thing. Here's why I ruled out A and B. I ruled out A and B because they are essentially the same thing. I cannot differentiate between A and B. There's no there's no real difference. If they're admission health history forms, okay, good. You told me what your health history is, or I review their prior medical records. I'm doing the same thing. So I can't differentiate between the two. And if it's a single choice question, not a SATA question, but a single choice question, and two answers essentially say the same thing, neither one of them are right. So I had to cross those off. So between assessing vital signs and performing light and deep palpation for fluid, which one would I do first? Well, I would assess the patient's vital signs first. Out of the things there. Now, what would I be doing a general review of just how they look? The first thing I do when you first walk in the room is you look to see if they're disheveled. Are they using good hygiene? How are they standing? Do they shake my hand? Right? That kind of thing. I do that first, but those answers are not there. Those answers aren't there. So if I'm initiating the physical exam, I'm going to assess the vital signs before I do anything else. Like before I listen to their lungs, for example, I'm going to do the vital signs. Number 8, if the nurse discovers that a patient's right elbow is swollen and painful during a physical exam, which action should the nurse take next? So it's really a first question, right? What do you do after you see that the right elbow is swollen and painful? Apply ice to decrease swelling and reduce pain. Percuss the area to determine the presence of fluid. Perform passive range of motion to promote flexibility. Inspect the patient's left elbow to compare its appearance. So if I discover the patient's right elbow is swollen and painful during a physical exam, which action should the nurse take next? So I know I need to do further assessment if I don't know what's going on. And there's not enough data here to tell me what's going on. It doesn't tell me they've got tennis elbow. It doesn't say they've been diagnosed with tennis elbow. What are you going to do? No, I don't know what the problem is. All I know is the right elbow is swollen and painful. That's all I know. So am I ready to intervene yet? That's the question I ask myself as it just conceptually. Am I ready to intervene yet? No, I'm not. I'm not ready to intervene yet. So I got to cross off A and I got to cross off C because those are both interventions. Apply ice is an intervention. Perform passive range of motion is an intervention. Okay, so I'm crossing off those because I'm not ready to take action yet. So I got to still assess. So do I want to percuss the area to determine the presence of fluid or inspect the patient's left elbow to compare its appearance? You remember when you learned physical assessment, did they teach you about percussion of the joints? Did they say that's part of a basic assessment? I hope you're saying no. I hope they didn't tell you that's part of the basic assessment. But comparing side to side is part of the basic assessment. So why would this be a fundamental question? This is a fundamental question because they want to know if you understand when you have two hands, you're comparing one hand with the other. When you have two elbows, you're comparing one elbow with the other. When you have two legs, you're comparing one leg to the other. When you have two sides of the chest, you're comparing lung sounds from one side to the other. That's a fundamental principle, y'all. You compare sides to see, like, is this a bilateral problem or a unilateral problem? And that's the fundamental principle that they're teaching you. So this principle should kind of resonate with you when you're taking NCLEX. NCLEX is very predictable in many ways. They test fundamental principles. Fundamental. So say, is this a fundamental principle that I need to palpate the joint? No, but I did learn as a fundamental principle that I compare side to side. That's always part of my basic assessment. All right, number 9. A client comes to the medical clinic because of complaints of hoarseness, sore throat, and chest congestion. Subsequently means next, after that. If you don't know what the word subsequent means, it means after that. The nurse conducts a physical exam. Which of the following data sets are examples of subjective data? And I already told you what subjective data was in a previous question. Respiratory rate of 22 and productive cough, lung sounds revealing crackles and use of accessory muscles. Patient states, it's hard for me to get a breath. D, slump posture and heart rate is 78. And E, patient report of sore throat and hoarseness. So they come to the medical clinic, conducts a physical exam, which of the following data sets are examples of subjective. So subjective is stuff I tell you. Objective is things I can measure and assess. It's something anybody else can also find the same assessment data. Subjective is stuff I can only tell you about it. You can't measure it. Only I can tell you about it. Respiratory rate of 22 and productive cough. Well, that's objective data. Lung sounds revealing crackles and use of accessory muscles. That's objective data. Patient states it's hard for me to get a breath. That's subjective data. Slump posture and heart rate is 78. That's objective data. Patient report of sore throat and hoarseness. That's subjective. Now we can, you might go, well, hoarseness could be objective. It could be, but they're coming in and saying, look, I've had hoarseness and sore throat. You go, okay, that's subjective data. They reported it. If they reported it, y'all, it's subjective. If they state it, it's subjective. So subjective is C and D, or C and E, sorry. Make sure you know the difference between subjective and objective data. You don't want to, that's such a basic fundamental question. You don't want to miss that. Now this one, number 10, I really like this, but if you've already, y'all, if somebody has already shut the video off, tell them to watch it till the end, because this is one of the most important questions on here. Match the assessment activity on the left with the type of assessment on the right. Oh, I did it wrong. I'm confused between left and right. All right, sorry. The type of assessment is on the left and the assessment activity is on the right. I'm sorry. I've always had trouble with my left and right, always. All right, well, we have to differentiate between problem-focused assessment or comprehensive assessment. Now, problem-focused assessment is what is often called just a focused assessment. Okay, just a focused assessment, which is focused on the problem or the body system in which the problem exists. Okay, so if they say, I'm having chest pain, you go, well, tell me more, let's do more of a cardiac assessment. I might get a 12 lead EKG and so forth. That's a focused assessment, a problem-focused assessment versus a comprehensive, which is head to toe. Okay, synonyms for comprehensive assessment are head to toe, complete, comprehensive, in-depth. All of these are synonyms for comprehensive assessment. And we're really tempted to always do a comprehensive assessment. But according to the National Council of State Boards of Nursing, they say there's really only 2 times you need to do a comprehensive assessment. We're going to figure out what those 2 times are here. Assessment conducted on admission. Assessment when a client complains of chest pain. Assessment when a client has a change in hemoglobin from 14.5 down to 10.2. Assessment upon return to the floor after surgery, or assessment when a client complains of new onset nausea. Okay, there's only 2 times, y'all. Only 2 times you should pick comprehensive assessment or head to toe assessment or complete assessment. As much as you want to impress the National Council of State Boards of Nursing, don't do it. You're going to get it wrong. You only choose comprehensive assessment when you're admitting them, and that includes in the ED. When they're in the DED, you can do a comprehensive head to toe assessment, even though I know ED nurses don't do comprehensive head to toe assessments. Oh, I know that. Don't be getting on me about this. I'm talking about NCLEX here. Okay, when they come to the floor, when you admit them, comprehensive head to toe assessment, or when they return from surgery, comprehensive head to toe assessment. You can also do, by the way, you can also do comprehensive head to toe assessment when they're discharged. I didn't put that on here. When they're discharged, you do a comprehensive, because you're comparing, when they leave versus when they came. So those are the times. That's why LPNs never do admissions, because you have to do a comprehensive head to toe assessment, and LPNs aren't doing comprehensive head to toe assessments. They can do problem-focused assessments, but not comprehensive. So when do you do problem-focused assessments? When a client complains of a specific complaint, like chest pain. Okay, if it says your patient's complaining of chest pain, what's your best response? Go in and do a problem-focused assessment, not a comprehensive assessment. Don't choose head to toe assessments. I'm going to get a 12 lead EKG. I'm going to listen to their heart. I'm going to do a set of vital signs. Right? I'm going to do that. I'm not going to do a head to toe assessment. When their hemoglobin drops, don't go, well, I should do a head to toe. Look, you do whatever you want in real life. I'm telling you, on the NCLEX, do not choose comprehensive head to toe assessment. Do a focused assessment. Why? So why you're assessing for bleeding essentially, right? So guaiac their stool, get a set of vital signs, right? That's a focused assessment. And then assessment when they complain of like a new onset nausea. Focused assessment. Don't be doing a comprehensive head to toe assessment with that. Y'all, you guys are like the best ever. Seriously, you're like the best subscribers ever. I never get any negative comments ever. You're the best. But I do sometimes get people say, well, in real life, right, this is what we do. And I know that. I know in real life, sometimes things are different. I'm talking about NCLEX here. Okay, NCLEX. These are the rules that you need to follow when you answer these questions. I hope you pay attention to this one. This is actually surprisingly important. I know how to do an assessment. I'm sure you do. I'm absolutely sure you do. But these are some of the fundamentals that you might have forgotten. All right. Thank you for being such a great audience. I mean that. Love you so much. You guys are amazing. You're super supportive. Share the video if you think somebody else could use it. Like it. If you like the channel, like the video, because that does help spreading the videos around. Have a great rest of your day. Bye.